Welcome back to the Friends of NPACE Podcast. We have a familiar guest, Tami Recesso, who's back with us. Just did an episode with her a few episodes back on physical and manual therapy, but we are here live at our Cape Cod 2024 conference. Tami's with us exhibiting, but we also have a very special podcast episode today as Tami has a new book called Luciano's Light that has just come out, and we're going to talk all about it. It's a fantastic overview and story of a personal journey that she's had with her son who has RTS, correct?
Correct.
Excellent. And so let's start there, Tami, because I think RTS might not be something that folks know about, and it's a rare disease. So can you give the audience an overview of what it is, and then we'll dive into the book and a few more things specific to the whole book and the journey that you've had. So RTS, what is it?
All right, thank you. RTS stands for Rubenstein Taybi Syndrome. It is very rare. It is a congenital deformity, and he was born with it. It was detected at 5 weeks of birth, post-birth. And in my book, I outline a lot of characteristics that are related to RTS. And also the fact that it's very, very rare, 1 in 300,000. There's a lot of important information around what to know about RTS for providers. And throughout our journey, we discovered that, which inspired me to write this book to support not only the providers, but also the families of children with special needs, including RTS and other diagnoses.
Amazing. And I guess where I'd love to start is in that 5-week period from the time that he was born until he was diagnosed, was it sort of, for lack of a better way of putting it, obvious from the onset, or were there certain things that happened that sort of indicated that this was something that he was going to have and develop? What did those 5 weeks look like?
Well, 5 weeks, as I outlined in my book, were very, very hairy. We were in the NICU for about 10 weeks. And he was failure to thrive. He was born prematurely, and it started with an onset of a very risky third trimester with polyhydramnios. So therefore, they did a lot of extra testing. Through MRI, they saw that the kidneys were overfilled and enlarged in utero, and that there was also something, a pineal cyst in his brain that was detected. So therefore, they were really on high alert around once he is born, we get to perform some genetic testing and see exactly what's going on. So we were fortunate for that. So it was early on blood tests, and it took them about 5 weeks. Boston Children's discovered a relationship between his blood and some of the similarities that are consistent with Rubenstein Taybi.
So obviously the healthcare team was on top of it and able to be in that NICU setting, which I think leads to a great second question here in terms of, so obviously as a parent, it's very concerning to have a newborn child going through that, but you also are in the medical profession, you're a medical professional and a healthcare provider. And so I guess give us a little bit of an overview of what it was like from a parent's perspective, but also as a healthcare provider's perspective as all of that unfolded.
Mm-hmm. It was a nightmare. I will definitely be honest with you. Even for somebody who knows a lot about medicine and medical background, this was my child. And it was really frightening, especially where there was a lot of unknowns and where it was very high risk delivery to begin with. I had 50 cc's of amniotic fluid in my uterus, and it could have exploded upon birth with C-section. So it was an emergency C-section. So right from the start, it was very, very different and very nerve-rattling, because a lot of these top-end physicians were really sitting at the NICU, in the NICU at the monitors and the incubators, scratching their head, trying to figure out this little fella and figuring out what's going on exactly, and trying to quickly discover whatever it is that is behind the symptoms that we're presenting.
Yeah, and I can only imagine having the background, thinking what it could be, and then having the professionals there in the NICU, sort of the same response in terms of, okay, what do we need to do here to sort of figure out? But the fact that it looks like, he went through the lab testing and the blood work, that was able to be used to identify what was going on is a credit to the healthcare team that you worked with. And so talk a little bit about all the different elements of the healthcare team that was involved from really, I guess, from that standpoint, but throughout the past couple of years and where he's at now in his life. What was it like then, and sort of what's been the involvement of folks throughout the course of the last few years?
Okay, so in the beginning, he was only 4 pounds and he was failure to thrive. So he was quickly losing weight, which was really concerning. And they didn't know why. And we were in the NICU in Winchester Hospital for about 4 or 5 weeks and decided to transfer to Boston Children's. Immediately, a speech therapist put her hand on his back as he was nursing and said he's aspirating. So she quickly diagnosed that, and we were able to remedy that by thickening his liquids, which to this day we still do. And that's still been an opportunity for him. And then he sadly was unfortunate enough to contract E. coli in the bloodstream and Legionnaires during his couple weeks stay at Children's. So we were then back in the ER and back in the NICU for 5 weeks of antibiotics via IV. And that's when we had the medical teams of 15 people, interns, and around us every morning, really just asking questions, putting all their brains together to figure out exactly what the plan of care would be and what the underlying diagnosis was. So once we discovered the diagnosis, it was, identified, we had a plan. We had a plan where a G tube was placed instead of an NG tube, which was, just attracting infection. He was sent home with oxygen, BiPAP machines to keep the airways open, thickened liquids. I learned a lot. I learned a lot through the experience. As a parent, I was really like, whoa, how do other parents do this that don't have the medical background that I do? And it was great. I was able to advocate for my child to make sure that he received the best care possible. And the least invasive care too. Like I was able to say, hey, let's just do what's necessary and nothing extra, because let's give him a chance to heal. And in my gut, like I know being a naturalist and physical therapist, less is more sometimes. And we had the best of the best watching him. So I felt really good about that.
Yeah, Boston, shout out to Boston Children's
Yes.
Hospital. They work wonders over there and are miraculous in what they do to care for all the kids that come in there for all the different needs. And I guess the medical background as a parent helps you with what you just said, to be able to say, okay, you have a leg up, if you will, on folks that may not have a medical background, to be able to help be a part of the team that's making those decisions, and the advocacy. And I think that's a great side point for folks is advocate for yourself in healthcare settings. If something doesn't feel right, if something is not clicking or whatever it might be, those are the opportunities. And if you don't alert your healthcare teams to what's going on, there's not going to be that opportunity to figure out solutions for that. So a sidebar there on that. And for parents, I think, talk a little bit about that, your experience with advocating, and any tips or anything that you might have for them if their child's going through any sort of medical experience, what that's like.
Definitely. So that's a lot of the reason why I wrote the book, was to support other families, just to help them learn from what worked for us and what didn't work for us and what's next for us. So I ended up navigating with the best of the best outpatient providers in terms of physical therapy, manual therapy specifically, which is my love and passion. I also navigated towards finding like the best of the best in terms of speech therapists on an outpatient basis, and realizing there are different varieties of physical therapists and speech therapists and occupational therapists and medical providers in general, right? Everybody has their own niche, and finding the right fit based on results instead of based on friendships. Because let's face it, we're looking for results and we're looking for fast results. And that's why we're spending the time with these providers. We want to just make sure that everybody's on the same page and advocating for your child around what your goals are for your child and what you want to see within 1 to 3 months. And if you're not seeing that, moving on to somebody else who can provide those results.
Yeah, and I think with healthcare and working in this industry for almost a decade now, what I've seen is you might be at your primary care office with something going on, get referred to a specialist. And if those healthcare teams aren't in communication with one another, you're the conduit to making the connection between what was discussed there and what might be happening with the specialist and any other elements of the healthcare team. So I would say it's important for folks, both parents and individuals as they get older, to be able to digest what they're being told and advocate on their behalf. So it's great that the book goes into that a little bit more and gives folks some insight into that. You talked a little bit about the manual therapy that he's gone through. Can you talk a little bit more about that and how it sort of specifically works with his organs and the central nervous system and what that's been like?
Yes, definitely. I had a mentor prior to even conceiving Luciano that coincidentally works with children with pretty severe special needs in Connecticut. And I had just happened to call him up when I was in the NICU and asked him a little bit about the kidney diagnosis. And turns out he was telling me all about how he's actually suffered from the same kidney issue, and his son did as well, and he had successfully treated it with manual therapy. So that piqued my interest, and I would travel 2 hours to and from Connecticut because quality care matters. It's not about the distance, it's about the quality of care and the results again. So therefore, he does a very specific type of therapy, which works on the central nervous system, a craniosacral approach, a manual therapy, muscular approach as well, where we're working directly with the central nervous system to help restore craniosacral rhythm so that everything can communicate properly. Think about your brain as your control center, and your spine carries out the signals just like an electrical set of wires, if you will. And if something is off or there's a disconnect or a slow to process, that will result in some type of dysfunction or a delay in development. So he worked with Luciano and his team, who are amazing, worked with Luciano on helping correct his central nervous system to make it as efficient as possible. He also specializes in visceral manipulation, which is literally working on the positioning of the organs in the body. So just getting everything to be in the right place and getting everything to be freed up if there is any type of an organ that's not in the right place, or it's stuck, or it's not functioning properly from a delivery or from a very crowded in utero experience with a lot of amniotic fluid. Who knows, like
Right.
what the children go through, right? So working on all of that so that everything can be in symmetry and can work as efficiently as possible. We just saw tremendous results and rapid results. And to loop back on your question earlier, he's now 13 years old.
Yeah.
He's doing really well in terms of PT wise, like he's walking around independently. He gets himself dressed. He needs some help with getting his food prepared, things like that, but he's starting to participate in some chores, and he has about 11 words right now that he speaks verbally. He speaks through an iPad talker for more advanced questions and explanation at this point. But yeah, that was one provider that helped him so much. Another provider was a speech therapist who is prompt certified. And prompt is actually like a specific specialty where the speech therapist will put the person's lips and face in the position for that sound. So it's almost like a proprioceptive retraining. And I get that from a PT perspective, grossly, like with the arms and limbs, but you can do it with the face too. So that was fascinating and I understood it and it was effective. Prior to starting school, Luciano had over 100 words verbally. Once he stopped receiving that because he went into the school system and didn't get the same therapy, because everybody's different, he lost all of his words down to one word, which was apple. And we were looking at why, what does apple mean? And turns out I have a picture frame in his room that says apple of my eye. He pointed to it and he was reading before kindergarten.
Wow.
So super brilliant and just the language all over the place. There's still more to be discovered around this of why they would have all these words and sentences and then lose them down to one. And now since bringing him back to that original speech therapist, he regained about 11 to 15 words verbally again. However, we're starting over again.
Yeah, yeah.
Somewhat.
So it's been a journey for sure.
Yes.
And you talked about, where he's at now. And it seems for the most part that he's living as much of a normal kid's life as he could be. Obviously, he has the speech therapy that he's going through, and it sounds like a few physical limitations, but it's amazing to hear that for the most part, it seems like he's able to be living a full and amazing life, which is spectacular to hear. So anything else on him in terms of what the future looks like as he gets older, and or is it sort of, we're gonna sort of see what happens as we advance, and we'll take, we'll cross each bridge as we get to them, if you will.
So in terms of that, they're really, because it's so rare, there's not a lot of findings around statistically, okay, where he should live a normal life according to statistics. And associated with RTS, they say there's some vision issues. He does have blocked tear ducts. He did have a tethered spinal cord that got to be released, which helped him start walking and coordinating swallow at about 3 years old. He is very sensitive to anesthesia, as are other children with RTS. So there are a lot of factors. And however, overall, he has a pretty clean bill of health. Like he's outgrown a lot of the kidney swelling and the drainage of the ureters situations. And I really credit it to a lot of manual therapy. And yes, to answer your question, the sky is the limit. There is no limit, right? Because we get to just keep moving forward with excellent care and just navigating the best way possible, so that he can have the best quality of life possible. So yeah, I have a vision for him.
Love it. And I guess, well, that's a great segue into my next question is, as yourself, how are you doing, and what does your day-to-day look like in terms of obviously professional career, having clinics throughout Massachusetts and New Hampshire for physical and manual therapy, and you're doing fantastic with that, as we talked about on the last episode, but you're also balancing a delicate personal situation. So what does that look like? And for lack of a better way of putting it, how are you doing with that?
I'm doing great. I'm very invested in a personal development and character development company called Clemmer Leadership.
Mhm.
And they have helped us learn a lot of tools around how to balance and how to find more time and how to speak more positively to myself around, okay, what's next versus I can't do it. So it's a lot of positive mindset information and a lot of tools that when we are in the squeeze, I know I get to just choose a tool and then move forward versus get stuck and be like, okay. So yes, I do a lot of things, accomplish a lot, and I've learned how to ask for help.
Yes.
And I've learned how to leverage my time and the people around me for support so that I can create more. What we did recently with the book is I created a nonprofit. So that will provide funding for families with special needs to receive free manual therapy, because not all families can afford to pay for manual therapy out of pocket, as I have over the years. I've been very fortunate. to be successful in my career enough to afford that. And I understand not everybody can, and I understand the importance and the benefit and the results. So therefore, I created that so we can offer that for others. To help the children grow and become better than statistics are showing. Like, that's my mission, is so Luciano and I can give back and share our experiences and help others grow as well and progress. And also just be more part of, just some strength training programs. Even with my practices, I'm looking to open up some strength training programs for children with special needs as well that can be part of this. And I actually just so happen to have a therapist on staff with pediatric experience that has been working with Luciano. And I'm seeing results with Luciano just from a couple of weeks of working with him. And I'm like, this could work. This is important. So why not? If I can, right? Why not combine it? Like, it can get dropped off from school and do it then, and other kids can come too, and it can be a social event. So there's so many win-wins around the ideas that are coming my way.
Yeah, it's it struck a nerve because I have a close personal friend who recently had a child that had spina bifida, and actually the child was born twice, lack of a better way of putting it, where they had to go in and fix the spine, and then she was in the hospital for another few months before she was officially born, if you will. And she's doing great and has had the opportunity to she's now, I believe, 2.5, 3 years old. But what you just said is something that I'm like, I need to go tell them about. This is something that might be able to help her. And it's amazing, because my next question was going to be, are there any external resources or foundations that you've worked with? And you started it, Tami. So that's fantastic. I think before we wrap up, I guess my final question is, where can people find the book? Where can they learn more about it, and where is it available?
Okay, great. So it's on Amazon. Luciano's Light, Our Miraculous Journey is the name of the book. And the foundation is called Luciano's Light Foundation. It was just registered 2 weeks ago, hot off the press.
Yes.
And yeah, it's just going to be it's going to offer a lot of beautiful, resources and support for all these children and these families. And thank you for being in touch. That's sweet.
Yeah, no, it really was. And now I got a tear in my eye here that I'm wiping away at the end of the podcast, which is, that's okay.
It's so good. It's so good.
It's, it really is. And I, is on a personal note, as somebody who's looking to having children soon, it's you don't think about it necessarily. It's something that might happen, but between folks that I've met professionally, folks in your personal life, you realize that it's a possibility. And the strength of yourself and the folks that I just talked about that are friends and other people that I know is unbelievably admirable, and just incredible. So fantastic, Tami. So folks, you can find the book on Amazon. Tami recorded a previous episode with us where you can learn more about some of the things she does in practice with manual and physical therapy. If you're in need, Recesso Physical Therapy up in New Hampshire and Massachusetts. And so you can certainly check that out. And Tami, can't thank you enough for spending time with us today to enlighten us about your journey, the book that you have out now, and everything that you're doing. It's all absolutely amazing on all the different fronts. And we're thankful to have you as a partner here with NPACE. And so folks, go ahead, check this out. It is a fantastic opportunity to learn more about everything we've just talked about. And without further ado, anything else, Tami, before we wrap up that you want to plug or let the folks know about?
Thank you for having me. I also created an online platform called doctami.com, doctami.com. And that's to reach others outside of New Hampshire and Massachusetts in terms of either a virtual visit or online exercise videos on how to perform exercises specifically and appropriately to alleviate back pain, neck pain, shoulder pain. So that's been also my mission. And I have a passion for manual therapy and specific success with alleviating sciatica related symptoms. So I created this so it could be, accessible to others all around the world, really. So check it out and let me know what you need. Thank you.
Amazing. So go check out all the resources that Tami has. And Tami, we'll check in down the road to see how you're doing, how Luciano is doing, and catch up again soon. So for everyone tuning in, we can't thank you enough for spending some time with the Friends of NPACE podcast. And this is going to wrap up this episode. We will see you back next time. Be sure to like, subscribe. You can find us on Apple, Spotify, YouTube, and I believe Amazon as well now. So any of your favorite platforms we're on, just search the Friends of NPACE podcast. We'll see you back next time. 2025 events are open for registration now as well. Check out npace.org for all of the updates, and we'll be seeing Tami out on the road next year for sure as well. And that will do it. Tami also speaks for us, and so she has a few programs that will be released online in the coming weeks as well. So lots of different ways to interact here. And so we'll see you next time. Thank you everyone for tuning in.
Thank you.